Good morning, and thank you for joining us today for our free webinar, Tips and Tricks for Telemedicine Insurance Billing in Illinois, featuring Sarit Hirschkorn. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. With the current state of the acupuncture profession, the nation, and the world, we have decided to add to our webinar offerings to bring in experts in telemedicine, practice management, and insurance billing, in addition to our traditional clinical skills-based webinars. Our guest speaker today has graciously agreed to offer sessions each day for a specific state so we can focus the content and share the most relevant with you. I would just like to go through a few housekeeping items now. We recommend viewing the webinar in Chrome, Firefox, and Safari, as you may experience slowness in other browsers. If you're having any issues with sound or video, we always recommend trying to refresh your page. If that does not work, we suggest trying a different browser. For everyone who registered, you will receive an email 5 minutes after we conclude with a link to watch the video on demand. And lastly, we will be holding all questions till the end of the lecture. If you have a question for Sarit, please use the questions tab to assure that we ask it at the end. But to communicate with any other attendees or to communicate technical difficulties, please use the chat tab. Now for our featured speaker, we are proud to introduce Sarit Hirschkorn. Sarit is co-founder and co-owner of AllAcuServices, LLC, a company specializing in insurance billing services for acupuncturists, massage therapists, naturopathic doctors, chiropractors, physical therapists, and social workers. After spending 2 decades working in corporate benefits outsourcing for multi-million-dollar companies such as PricewaterhouseCoopers, ACS, and Mellon Bank, Sarit now applies her deep knowledge and understanding of the insurance industry to the field of insurance billing for holistic healthcare providers. Please join me in welcoming Sarit.
Thank you, Jeffrey. Good morning, everyone. I make today's focus about telemedicine. My name is Sarit Hirschkorn, as Jeffrey said. I am the co-owner, co-founder of a company called AllAcuServices. My partner in the business is Robert Venna, who is a licensed acupuncturist in the state of New York and in New Jersey. What I want to do today is I want to talk a little bit about terminology and just understand the differences between telemedicine versus telehealth. I want to talk about what is it that as an acupuncturist we can bill for under the telemedicine services. We'll talk about how often you can bill for these services, what falls within the scope of services, and then what I want to talk about is what should you be charging for telemedicine. And what I'm going to do is I'm not going to give you a price, but what we'll do is we'll give you a formula to figure out how to come up with the price for telemedicine codes. And then we'll get down to the nitty-gritty. We'll talk about how do we actually put in a claim through the insurance company for telemedicine. We'll talk about the modifiers, etc. And in the end, we'll talk about consent forms and HIPAA. So why don't we get started first with just some terminology, and then we'll continue from there. So first is, what is telehealth? Telehealth is the use of electronic information and communication by a provider to deliver services such as assessment of diagnosis, a consultation, maybe a treatment, education, and all these things. Let's pay attention to them because we're going to come back to them when we figure out what it is that we can provide as an acupuncturist. Care management and then self-management of the patient, okay? We are learning and we know that it has to be a patient-initiated service. And so how can this be a patient-initiated service? It is okay for you to reach out to your patient and let them know, A, you are available for telemedicine, you are available for a consultation with them, because many patients may not know what telemedicine is. So just let them know that you're available for a consultation. If they would like to talk to you, they can reach out to you, they can schedule an appointment with you. When we look at telemedicine or telehealth, right? Telemedicine is a portion of telehealth. It falls under telehealth, and it's really the use of emails, text, the use of a fax, the use of live stream video, just like we're doing now, right? And the use of an actual phone. So you can reach out to your patients. You can let them know that you're available if they would like to talk to you. The law tells us that telemedicine has to be used for existing patients that are under your care for either acute or chronic pain. You'll see that a lot of things change, right? There are laws out there. However, insurance companies are changing because of COVID-19. And we'll talk about that when we talk about the specific insurance companies. If you end up having a telemedicine service with your patient, and specifically, we're going to focus now on a phone call, so not the use of text, not the use of a live stream video, but actual a phone conversation with your patient. And it leads to you seeing the patient within the next 24 hours. You cannot charge for telemedicine, but you will need to charge for your acupuncture treatment. Okay. Let's talk about specifically Illinois and what we're seeing in Illinois. Okay, so Illinois does offer telemedicine. They are putting some regulations in place. If you are providing telemedicine, you cannot ask patient to be seen in person. B, it has to be medically necessary. Okay, so those are the things that the insurance that the state of Illinois would like for you to make sure that you offer, and it has to be appropriate. Okay, they also confirm that not all insurance companies have to offer it, and if you as a provider are not allowed to provide services today to your patient, you probably most likely will not be allowed to provide telemedicine services. So what does it really mean? It means that if Jeffrey does not have acupuncture services today through an insurance company, for the most part, he will not have telemedicine services. Let's talk about what it is that I can actually do being an acupuncturist, not being with my patients in the room, not needling my patient. What is it that I can offer them? So it's a discussion with my patient about how they're feeling, their current condition, maybe previous condition that they had that they would like to discuss with you. Something else that you can do with them is a tongue diagnosis. You can also offer them some Qigong exercises, breathing exercises, Tai Chi, yoga, and all of that is face-to-face, live stream video. You can either show them the exercise, demonstrate, or have them do it, comment on these exercises, and let them or teach them how they can take it as a takeaway and do it on their own time. Similar to that, some meditation tips, or you can meditate with them. You can discuss nutrition with them. Many of us are home. Many of us need some nutrition tips and maybe better eating habits. You can also talk about how do I boost my immune system. So that's something else you can discuss with your patient. You can show your patient self-acupressure. So give them a couple of points that they can use maybe to relieve stress or to relieve a specific pain that they may have, and let them know what it is that they can do to help themselves. The use of hot and cold packs is something else that you can discuss with them, again, depending on their diagnosis, depending on their condition. If you're prescribing herbs, so definitely tell them, how do you take those herbs? How do you cook those herbs? It's something else that you can spend time with your patient, guiding and explaining on how they should be taking those herbs. And then last but not least is ear seeds. The use of ear seeds. We have clients that have sent their patient ear seeds. They're then spending the time with their patient, putting in the ear seeds and placing them on the ear. I want you to note and take it with you as to part of telemedicine is decision-making and note preparation. And we'll talk about what it means when we get to talk about the codes. So let's talk about the codes. Telemedicine, in essence, is an evaluation. Okay, I'm sitting in front of my patient. I'm not in the same room with the patient. I will provide the same standard of care as if the patient was sitting with me in the room. The only thing I'm not going to put in the patient is needles, okay? But I will perform an evaluation on my patient, okay? Whether I'm discussing, as I said, herbs, or just saying how they're feeling, or looking at their tongue, it is a form of an evaluation. That time that I'm spending with the patient, time that I'm going to be measuring in minutes. We're looking at 3 different categories for measuring the minutes. So we're looking at ranges. We're looking at a range of 5 to 10 minutes, at the range of 11 to 20 minutes, and then it's 21 minutes over. And I want to make sure that it's super clear. These codes are not, let me add them all up. It's one of these codes can be used once every 7 days. And we'll talk about an example in a second. So either I use the 99421, or I use the 99422, or I use the 99423. It's not that I use all 3 and add up my minutes, okay? It's, let me see how long I spent with Jeffrey. I spent with Jeffrey 60 minutes. If I spend with Jeffrey 60 minutes, I can only charge for 1 code, and it's 99423, okay? We have 2 different sets of codes, and that's to distinguish between a phone conversation or a digital evaluation, a live stream video where I can hear Jeffrey and Jeffrey can hear me. But the codes in terms of ranges and where they fall are exactly the same. It's the system that you use is what changes on these codes. So if I spend with Jeff 21 minutes, I'm going to charge 99423. If I spent with Jeffrey 60 minutes, I'm also going to charge 99423. You get paid the same whether you spend 21 minutes or 60 minutes. Now, what goes into my minute calculation? So Jeffrey and I had a meeting scheduled today for 1 o'clock. The first thing that I was doing is preparing. I was reviewing notes for previous sessions. And that took me 5 minutes. So that at some point I reviewed the note. It took me 5 minutes prior to the meeting. I then spent 10 minutes with Jeffrey, talking to Jeffrey, maybe showing him how to do ear seeds. And after the 10 minutes, I actually documented the session. And you need to make sure that you are documenting the session, whether it's electronic documentation or hard copy documentation, you must document, okay? Altogether, I spent 5 minutes on reviewing notes before the session, 10 minutes with Jeffrey during the session, and then 5 minutes documenting. 20 minutes I now counted that I spent altogether. I will be charging for code 99422 because it falls into the range of 11 to 20 minutes. With that said, let's talk about how we actually bill for these codes. So usually we submit several codes. We submit for an evaluation. We may submit for the needling. We may submit for the moxa. Here, because you're not actually performing these services, but guiding the patient on how to do these services, it all falls under one umbrella called telemedicine, or what I look at is very simple, an evaluation, okay? These codes represent an evaluation, except they're done via live stream video and not with the patient sitting with you in the room. So how do I actually bill for it? And Jeffrey, what I'm going to do is I'm going to ask you to bring up that claim of ours, and here we go. So we have the start date and the end date on the claim. In column B, where you usually put place of service 11, okay, which represent in-office setting, we're going to put 02. The CPT code, right, that I'm going to use, or what I refer to as procedure code, is going to be either whether I use the phone conversation or video is 99423 or 99443, depending on how I had the discussion with Jeffrey, and then a modifier of 95. So that's how we are going to bill for the particular session. let's switch back to the presentation. And what I want to do is I actually want to talk about prices. So I don't know what everybody's charging. And what I would like to do is give you some sort of a formula to figure out how to charge for these codes. We're going to take a look at what you're charging one set of needling. So I put one set of needling up in the right-hand corner, and that's 97810. I'm now going to compare these codes, one set of needling, and we're going to try to really simplify this, and we're going to round numbers either up or down. But if you see what I put is what's called a relative value next to each one of the codes, you don't really need to understand what relative value means, but what you need to understand is what is it worth from an insurance perspective in comparison to one set of needling. So code 99423, when I compare it, or what the insurance compares it to your one set of needling, is worth about 40% of it. So if you charge $100 for 97810, you'll charge about $40 for either 99421 or 99441. The second category, which is 11 to 20 minutes, is worth about 80%, right? If I look at 99422, is worth about 6%, if you want to be exact. And if you look at 99442, it's worth about 78%. As I said, I'm going to round it up or down a little bit. And I'm going to charge 80%, so I'm going to charge $80. And then the last code, if I spent over 21 minutes or more, it's worth actually more than one set of needling. So I'm going to charge about $120. I'm just going to add that $10 to what I charge to my one set of needling, or $10 to $20, and that's what I am going to charge. And in the end, if you guys are not, if we need to review these formulas again, I'll be happy to do so. I want to focus on the different insurance companies and what they're offering. And again, this is just high level. This changes daily. I would suggest that you call the insurance companies. And this is just what we are saying for patients that we are calling in. It does not mean that your patients will have exact same coverage. Aetna, ASH, Cigna, Blue Cross Blue Shield of Illinois, they have many, many plans and many, many different coverages. What we are seeing is that Aetna in general, for the plans that they do allow acupuncture, they are allowed telemedicine. They went as far as waiving copays and waiving co-insurance and even waiving deductibles. Companies such as ASH, so if you're participating with ASH, are not allowing telemedicine at all. But then again, if you have a patient who's interested in telemedicine and they do have ASH, I would suggest that you call the insurance company and find out if they have coverage. And I'll talk about what you should be documenting in a second when you call these insurance companies. Blue Cross Blue Shield of Illinois. So that's a little bit a tricky one. So Blue Cross Blue Shield of Illinois does not allow you to perform an evaluation today, or they do, they just don't pay for it. They're telling us and they insist that they will pay for telemedicine, even though they are not paying for evaluations. So we shall see. We have submitted a couple of claims. We're waiting for those claims to process. However, they are definitely telling us that they're allowing telemedicine only during COVID-19. And that started on March 16th. I want to talk about Cigna. Cigna told us that their system is not equipped to handle so many telemedicine claims. Although we did submit a telemedicine claim, it did get processed. They paid about $50. Cigna went and published and told users or providers to use the regular evaluation codes or E&M codes. So those that range between 99211 to 99215. They did tell us to use a place of location as 11 as if you're using an in-office setting. However, pay attention to that. Your modifier, even though you're using an E&M code or an evaluation code, is GQ. Okay? Cigna went further out and said, not only we would like to offer it for existing patients, we are opening it up for new patients. So you can use this also for your new patients. We will allow it. We want to alleviate the number of people that are ending up in the ER in those emergency clinics, they want to keep people at home. And so they allow new patients and existing patients to be treated via telemedicine. Cigna also said that it's okay for people to use phone, and you can see that down here, video, FaceTime, Skype, right, on any appropriate use of system that you see equipped for telemedicine. We are seeing that many people are waiving the HIPAA penalties, or many insurance companies waiving the HIPAA penalties due to COVID-19. I want to share a couple of links I found, and Jeffrey can talk about Daxi.me if he has more information. But I strongly suggest that you use a HIPAA compliant system. You don't want to compromise your patient's data. The links that I published here, and I suggest that you take a screenshot because we're not sharing the presentation, but feel free to take screenshots. The links that I published here offer some sort of a free version of a HIPAA compliant system. So either they offer it for a month free trial, or they offer it for a certain number of sessions that are free. And if over these sessions, they start charging. Daxi.me, I think it's free for the first month, and then they have some sort of a small fee that they start charging monthly. Also, we suggest that you use a consent with your patient. The patient does need to sign a consent to make sure that you can provide telemedicine services via the phone. It would be a good idea that your consent will have some paragraph that says that if the data does get compromised, you're not liable for the data being compromised. Systems such as Unified Practice and Jane EMR programs, they also offer telemedicine. They have telemedicine platform that are free and part of their system, and they're definitely HIPAA compliant. With that said, Jeffrey, we can open it now for questions, and I'll be happy to answer any questions that anybody have. So, Jeffrey? And I don't know if Jeffrey can hear me. Oh, yeah.
Can you hear me?
Yeah.
All right, perfect. All right, we do have a few questions here. It looks like pretty early on, we got a question. I do not know if this is only my problem. The hardest for me, I have been doing all of this without charging with existing patients. Switching over to charging them is not easy.
So
do you have any advice about that? Actually, a good question.
Here's what I would say. I mean, it depends on how you want to run your business. So if you are offering some sort of a free session, that's great. You can reach out to your patient and tell them that you offered it and it was complimentary. And as of a certain date, you're starting to charge. And especially if they have insurance, you will check their coverage and you'll find out if they have a copay or a deductible or co-insurance. When you are calling the insurance, and I'm going to go on a tangent for just 1 second, and then I'll jump back to answering the question. If you are calling the insurance, I tend to do this a lot. If you're calling the insurance company, make sure that you find out if your patient has coverage. It has to be provided by a licensed acupuncturist, so specify that. I want to provide my patient telemedicine when it's provided by an LAC or licensed acupuncturist, because many patients can have telemedicine services, but they're not provided by an acupuncturist. Maybe they're provided by an MD. So you do want to know if you're the one who can provide these services. The thing that you want to find out is if your patient has a copay or a co-insurance or a deductible. If you need an authorization for this treatment, is there a diagnosis restriction? Find out, okay? In the end of the call, document who you spoke to. Take a call reference number, the date and time that you spoke to them. So in the event that they're not paying, you can appeal and you have some sort of a mechanism for a fight back to say, hey, pull up the call. You told me my patient is covered. So going back to the question, one thing that would help is you can tell them that the first few are complimentary. And then going forward, you will verify their coverage. And if they're covered, right, you can find out if they have a copay. If they don't have a copay and they don't have a deductible, there's still no cost to them. And if there is a copay, you can let them know that there is a copay or a deductible and ask them if they're interested in still having these sessions. So that's if you're going to go and start charging. But you have to be consistent across all your clients. Clients that have hardship, just make sure that they sign the hardship consent because you either charge all your patients or you charge none of your patients. They have to be the same unless your patient has a hardship.
All right. Have any insight on United Healthcare?
So when we called United, United told us they're not covered. They're not covering it. But it really depends on the patient's plan. We have called quite a few. They told us they're not covering. I wouldn't listen to me. I would still continue calling. And the reason that I wouldn't listen to me is because it changes daily. So what they've told me yesterday that they're not covering, and although we've been calling since March, most of the plans that we have called, they told us they're not covering. That may change today, that may change tomorrow. So everything that we shared here with regard to these insurance companies is as of, right, yesterday, this morning, but it changes every minute, it changes daily. They keep on publishing new information. Some insurance companies are telling us to use the regular evaluations, such as the VAs and Cigna. So yes, United told us they're not covered, but if you have a patient who's interested, verify their coverage.
And after watching you give this lecture about 9 times, you would say that then the next step for recourse would be to have the patients call.
Yes.
And if the patients call and press the insurance companies, they may make an exception or allow it, right?
Exactly. Absolutely.
Right. See, I learned something from being here every day.
This is the apprentice, you know.
And then let's see, can you go back over the modifier of GQ? That was with Cigna, correct?
So GQ was for Cigna specifically. This is what they publish on their site. We are seeing the insurance companies telling us to use either 95 or GT. I would call the service center and ask, do you want me, right? When I call and verify coverage, I usually don't ask, right? So when the verification team calls as a biller and we verify coverage, we don't say, hey, is my patient covered for telemedicine? We say, is my patient covered for code 99423? We want to be as specific as possible. You want to be specific as possible because you don't want to leave room for error. And if they tell you, yes, it is covered, right? You need to say, how can your system handle it? Do they handle it with a 95, the GQ? Because you don't want the claims to fail. So ask. Don't be shy to ask. Worst case scenario, they'll tell you, I can't tell you. But there's no harm in asking.
Perfect. Next question. Does anyone know if the requirement to see a patient in person prior to conducting telehealth sessions is waived in Illinois or in Illinois for acupuncturists at this current time?
So I'm not sure that I'm clear on this. So you saw the patient
first time patients versus existing patients. Do they have to be existing in Illinois to be able to see them for telehealth?
I think it depends on the insurance company, right? Because these insurance companies are private, right? And they can adopt the state laws or they can add to them. Cigna specifically told us that they're allowing new patients to be seen by medicine. You know, if you wanna, when you call the service center and you verify the one thing that we say, hey, we're located in New York, or hey, we're located in Massachusetts, you know, they know your scope of service in the state. They can go ahead and check. They may put you on hold for 5 minutes, but they can go and check what the scope of service is for your particular state. And they can tell you whether or not you're allowed to see a new patient or an existing patient. So again, the reps can tell you and provide you with that information.
Alrighty, and we have this question yesterday, so good that we got it again today. Any advice for HSA, HRA, FSA super bills, and what CPT codes to use for telemedicine?
Wow, that's a loaded question. There's a lot of information here, so yeah. Okay, so let's start with super bills. Simple, okay? What is a super bill? Okay, super bill is I don't want to bill the insurance company. Right. When we bill the insurance company, what are we doing? We're providing a service to our patients. We're saying, hey, don't worry about going and submitting this claim to your insurance. I will do it for you. And I'll be really nice and I'll wait for that check to come in the mail. Or if the check comes to you, you'll just hand it over to me. Okay. That's when we build the insurance company. When we provide a super bill, we say, okay, we are not going to bill on your behalf. You're going to pay me for today's session, and I'm going to give you a super bill. So if the question is, can I give super bill for these services? Yeah, go ahead, give a super bill for your patient for these services, and your patient can try to get reimbursed for these sessions. So there's no harm with super bills. Okay. What was the next question? HSA, FSA?
HRA.
HRA. Okay, so HSAs and HRAs are very similar. I'll go on a tangent again. I'll explain what these are so we all know, and then I'll ask a question. So HSA is a health saving account, okay? HRA is also a health saving account. Difference is where the money goes, okay? So HRA is you put money in a health saving account and you keep it in a separate bank account, and it's used for your medical services, okay? If you don't use it in the end of the year, first of all, it's tax deductible, so that's awesome, okay? If you don't use it in the end of the year, guess what happens to it? It rolls over to the next year. You don't lose it, okay? If your employer, right, so if the patient's employer puts money towards the HSA, it also goes into that account. And in the end of the year, guess whose money it is? Mine, the patient. You know what happens with HRA? If you don't use the money that the employer gives the patient in the end of the year, it goes back to the employer, okay? So not to the patient. But the money that you put is always yours. So yeah, great, that goes. Can you use it for, so HSA, so if I have an HSA plan, it usually means that the reason that I put money out there is for services that the insurance will not pay for, i.e. co-pays, co-insurance, deductible, right? What they will not, one thing that they will not pay for is denied benefits. If you don't have acupuncture services, okay, your HSA will not pay for it, okay? It has to be a covered benefit, okay? If you do have acupuncture services, right, and they go towards your deductible, your HSA will kick in, or your HRA will kick in, okay? So HSA covers benefits, or will pay for benefits covered under your plan. And if they are covered but did not get paid because of a deductible, or you have a co-insurance or copay, the HSA will pay, or the HRA, they're very similar. FSA, which is a flexible spending account, however, is different. It is money that you as a patient put in an account. In the end of the year, you either, you snooze, you lose. You don't use that money, you lose it. You can't roll it over to the next year. So if you haven't used it, you lost it. You can use it for medical services, and you can use it for medical services, and they have strict guidelines. So I don't think you can use it for cosmetic procedures. However, telemedicine is not a cosmetic procedure. And as long as it was a valid procedure where their provider actually submitted for it and you didn't get paid, they actually have to be submitted and you didn't get paid, the flex spending account will reimburse you back once the patient submits the EOB to them. So yes, flex spending will pay for it. HRA, if it's not a covered benefits, will not pay for it.
All right. And let's see, when you give advice over the phone, we call it telemedicine. Could it be called a diagnosis also?
A diagnosis?
Mm-hmm.
You can call it whatever you want to call it. It falls under telemedicine procedure. So, yeah, call it, yeah.
All right, let me just take a look at the chat. It looks like I think we have answered all of the questions. This might be a record. We did it in 34 minutes, so pretty good. If anyone has any last-minute questions, feel free to type them in right now while I, kind of send you guys off for the day. I really want to thank everyone for taking the time out today to join us for this really informative webinar, and we all want to thank Sarit for her amazing, incredible information. To learn more about Sarit's services, which is AllAcuServices LLC, I will quickly put a link to that in the chat. And you can definitely reach out to her with any specific questions. And let's see, here's that website. And then really just thank you very much, everyone, for your time. I hope you all have a wonderful day, and we will see you next time.
All right. Thanks, everyone.
All right. Have a nice day.
Bye.
Bye.